back in the lung region, and the other laterally from musculus rectus. And as usual, 4 steps. Place your hand under the kidney. Kidney is here, but close to the back, yes, of the patient. You place your hand under it. Then, during inspiration, make skin fold. During expiration, penetrate, and this hand, try to reach this hand. Penetrate, and then ask the patient to inspire again. When the patient will inspire, the kidney will go down and will be between your hands. And you can slide and analyze its surface. Put your hand here, please. This is a kidney, yes? You try, just place. So, place your hand, inspire next. No, you just put it, place your hand, make skin fold, penetrate, and then I ask the patient to inspire. The patient inspires and kidney goes down. And it gets between your hands. And at the peak of inspiration, yes, you can slide. You can assess the surface. Clear? The level of umbilicus, do any of you have?
Maybe I have.
The level of from right and left from the umbilicus, and press it, yes, because renal arteries are deep in the abdomen, yes, and if patient is thin, it's possible. Deep, and you auscultate. If there is any turbulent blood flow, you will hear normal. And from the right side, again deep. That's all.
How about the back side? From the back side?
No, from the back side you can't auscultate it, but from the back side you check strike symptom. Painfulness in the lumbar region. If patient has, for example, acute pyelonephritis or abscess of kidneys, this area will be painful. You may do it this way. Strike over lumbar region. Just you can do it just over the back, or it's better to do it using your left hand. So if there is any inflammation, it will be painful.
What about ascites? Can we see ascites in kidney diseases?
Ascites? Ascites can be present due to decreased oncotic pressure. We discussed today, yes? And we have already discussed it. Yes, when patient is in horizontal position, fluid is in this part. Yes, you will percuss, tympanic percussion note, and when you reach fluid, it gets down. And the same from the other part. When patient stands up, fluid goes downwards, he will be tympanic, and when you reach fluid, it gets down again. If patient says that there is no urine, yes, you should differentiate between anuria and ischemia. Yes, ischemia. You can, because if the urine is present in the urinary bladder, it will give dull percussion note when you reach a urinary bladder. So if it gets dull, yes, it means that the urine is present, yes, but it can't be discharged. It's ischemia, yes. If there is no dull sound, it means that no urine in the urinary bladder. That's all.